An ovarian cyst is a fluid-filled sac that forms on or inside an ovary. Ovarian cysts are common and can occur in women of all ages, but they are particularly prevalent during the reproductive years. Most ovarian cysts are benign, non-cancerous, and often resolve on their own without treatment. However, some can cause complications or may require medical intervention. Types of ovarian cysts. There are several types of ovarian cysts, including functional cysts, the most common type, which typically occurs as part of the menstrual cycle. They include follicular cysts, formed when a follicle, a sac that contains an egg, does not release its egg and continues to grow. Corpus luteum cysts, form after the follicle releases the egg and closes off, filling with fluid. Dermoid cysts, contain various tissues, such as hair, skin, or teeth, and are usually benign. Endometriomas, associated with endometriosis. These cysts form when endometrial tissue grows on the ovaries. Cystadenomas, benign tumors that develop from the cells on the outer surface of the ovary and can be filled with a watery or mucus fluid. Polycystic ovaries, part of polycystic ovary syndrome (PCOS), where multiple small cysts develop on the ovaries, often accompanied by hormonal imbalances. Causes. The exact cause of ovarian cysts can vary, but common factors include hormonal changes. Fluctuations in hormones during the menstrual cycle can lead to the formation of functional cysts. Endometriosis. This condition can cause endometriomas due to the presence of endometrial tissue on the ovaries. Pregnancy. Cysts can form during pregnancy, usually as corpus luteum cysts, which are typically harmless. Symptoms. Most ovarian cysts are asymptomatic and do not cause any noticeable symptoms. However, larger cysts or certain types may produce symptoms, including pelvic pain, dull or sharp pain in the lower abdomen or pelvis, which may occur during menstruation, intercourse, or physical activity. Bloating, the feeling of fullness or swelling in the abdomen. Changes in menstrual cycle, irregular periods or changes in menstrual flow. Urinary symptoms, increased urgency or frequency of urination if the cyst presses on the bladder. Difficulty emptying the bladder, if the cyst is large enough to compress the bladder. Nausea or vomiting, especially if a cyst ruptures or if there is associated pain. Diagnosis. Diagnosing ovarian cysts typically involves the following steps: medical history and physical examination. Healthcare provider will ask about symptoms and perform a pelvic exam to assess for abnormalities. Imaging tests. Ultrasound, the most common imaging method used to visualize ovarian cysts. It can help determine the size, shape, and nature of the cyst, fluid-filled or solid. CT scan or MRI. In some cases, these imaging tests may be used to provide additional detail. Blood tests. CA-125 test. This blood test measures the level of the CA-125 protein, which can be elevated in ovarian cancer or other conditions. It is not routinely used to diagnose cysts but may help assess the risk of cancer in certain situations. Treatment. The treatment of ovarian cysts depends on several factors, including the type, size, and whether symptoms are present. Options may include observation. Many functional cysts resolve on their own without treatment. Healthcare provider may recommend monitoring the cyst with follow-up ultrasounds over a few menstrual cycles. Medications. Pain relief. Over-the-counter pain relievers such as ibuprofen or acetaminophen can help manage discomfort. Hormonal contraceptives. Birth control pills may help regulate menstrual cycles and prevent the formation of new cysts. Surgery. If a cyst is large, persistent, or causes significant symptoms, surgical intervention may be necessary. Laparoscopy. The minimally invasive procedure to remove the cyst or the affected ovary. Laparotomy. The more extensive surgical approach may be required for larger cysts or when cancer is suspected. Complications. While most ovarian cysts are benign, certain complications can occur, such as rupture. A cyst can burst, causing sudden and severe pain, internal bleeding, and potential infection. Ovarian torsion. A large cyst can cause the ovary to twist, cutting off its blood supply, which is a medical emergency. Cancer. Though rare, certain types of cysts, especially complex or solid ones, may require further evaluation to rule out ovarian cancer. Prognosis. The prognosis for ovarian cysts is generally favorable. Most functional cysts resolve without treatment, and many women experience no long-term effects. However, regular follow-up with a healthcare provider is essential to monitor any changes, especially if symptoms persist or worsen. Conclusion. Ovarian cysts are common and usually benign growths that can occur in women of all ages. While many cysts do not cause symptoms and resolve on their own, understanding their types, potential symptoms, and treatment options is essential for effective management. If a cyst is suspected or if symptoms arise, it's important to consult a healthcare provider for appropriate evaluation and care.